Hello G, how are you all? Let's take a PYQ topic. 25-year girl presented to the OPD with abdominal pain and distension. On PV, a adnexal mass was felt in the left fornix. On ultrasound, a 10 centimeter ovarian mass had benign tumor characteristic. Okay. Now they are asking us what is the most likely diagnosis. So basically they are asking us which ovarian tumor is common in which age group and the ovarian classification. So let's study. We divide the ovarian tumor into 5 different types on the basis from where the ovarian tumor has originated. Okay, on the number 1 there is epithelial cell tumor. Now these are the most common tumor of all the ovarian tumor. Okay, these are the most common tumor. In fact, they are 90%. Okay, but these tumor are only found in the old age, as usually the tumor are found in the old age. On number 2 is the germ cell tumor. Germ cell tumor, they are rare ovarian tumor, since epithelial ovarian tumor are the 90% of all the ovarian tumors. So of course germ cell tumor will be rare, and this germ cell tumor, they originate from germ cell or the ovum. Okay, and these are the most common tumor in the young age. So these are the most common tumor in the young age, that is 25 years. Now the number 3 are the follicular cell tumor. You all know that germ cell or ovum is in a follicle, and follicle mainly contains of 2 type of cells. So are these follicular cell tumor, granulosa cell tumor and theca cell tumor. Number 4 is stromal cell tumor. If the tumor is originating from the stroma of the ovary, okay, it can be fibroma or it can be any other stromal tissue tumor. Number 4 is metastatic tumor. If the primaries of the tumor are somewhere else, not the ovary. Okay, ovary is the secondaries. Ovary are the secondary. Some tumor has metastasized from its primary and come to the ovary, then it will be metastatic tumor. The most common tumor which metastasizes to ovary is stomach adenocarcinoma. How we will come to know that this ovarian mass was primary or the secondaries or the secondary? Okay, so we will remove that ovarian mass, and on histopath if we get the signet ring cells, then it means that it was secondary. Okay, and this type of secondary tumor in the ovary is known as Krukenberg tumor. Okay, so basically you can learn this fact by the thing. If you see any in the girl hand, in the girl hand, if you see any ring, it means that the girl is not a primary girl, it's a secondary girl. Okay, now let's see what are the different type of epithelial cell tumor. The different type of epithelial cell tumor which were the most common tumor and they were only found in the old age. Okay, now these epithelial cell tumors, they are divided on the basis of the content of the cyst. The epithelial cell tumor, they usually form a cyst. On depending on the content of the cyst, we divide the ovarian tumor into subtype. If the content of the tumor is serous, then we will say it serous cyst adenoma if it is benign, and if it is malignant, then we will say it serous cyst carcinoma. It is 90% of all the epithelial cell tumor. So most common ovarian tumor was epithelial cell tumor, and the most common epithelial cell tumor is a serous cyst adenoma or carcinoma. So both benign and malignant common tumor are serous cyst adenoma and carcinoma. The other tumor marker which can be there is mucinous cyst. So other tumors which can be there is mucinous cyst adenoma if the content of the cyst is mucus. If the content of the cyst is solid, then it can be Brenner's tumor. If the content of the cyst is endometrial tissue and the blood, then it can be endometrioid tumor. And if the content of the tumor is clear cell tumor, then it can be the clear cell tumor. So this has been asked in recent INSET PYQ that clear cell tumor belongs to which class of the tumor. So it belongs to epithelial cell type of the tumor. Now if a old female is coming to us with the ovarian mass, it is very clear that it is going to be epithelial cell tumor, and in the epithelial cell tumor it is going to be serous cyst adenoma or carcinoma. right? So we can confirm our this finding that it is serous cyst adenoma before operating it, okay, by getting the tumor marker done. The tumor marker of the serous cyst adenoma is CA 125. Okay, so that was about the epithelial cell tumor. Let's learn about the germ cell tumor. The germ cell tumor, these are rare tumor, but these are found in the young age. Okay, so germ cell tumor means that this tumor has originated from the ovum or the germ cell. As you all know that when germ cell fertilizes with the sperm, then it forms yolk sac, placenta, fetus, all these things. So we have divided the germ cell tumor depending on the content of the germ cell tumor. Okay, so if the content of the germ cell tumor is fetal parts, so don't imagine ki in the ovarian germ cell tumor you will get a full fetus. So we get the fetal parts. So if on the germ cell tumor we get the fetal parts, or we what we say it in other words, 3 germ cell layer products. Okay, for example, if you are getting hair, maxillary tissue and all other derivatives of the 3 germ cells, ectoderm, endoderm and mesoderm, then it is going to be the teratoma. Okay, we will name that ovarian germ cell tumor as teratoma. Now its benign form, that is benign teratoma, is the most common of all the germ cell tumor. So it is the most common of all the germ cell tumor. Its benign form is most common of all the germ cell tumor, right? So if any young girl is coming to us with a tumor, then it is going to be the germ cell tumor, and of the germ cell which variety it will be? It will be the germ cell variety will be the benign teratoma. Okay, benign teratoma is also known as dermoid cyst. Okay, its malignant form is rare, so we are not going to discuss here malignant form. In this picture you can see that this is the ovarian mass, and this is the hair. These are the hairs. So similarly we can see hair, maxillary tissue, thyroid tissue, all the ectoderm, endoderm derivatives. So basically what is more common is the hairy structures in the ovarian masses is benign dermoid cyst or the benign teratoma. Okay, now let's see what are the other type of the ovarian tumor. The other type of ovarian tumors are choriocarcinoma or non-gestational trophoblastic neoplasia. If the germ cell tumor content is the placental tissue or the chorionic villi, then it is choriocarcinoma. And on number 3 we have yolk sac tumor. If the germ cell tumor content is yolk sac tissue, then it is yolk sac tumor. And on number 4 we have dysgerminoma. Now what is this dysgerminoma? The germ cell, that is the ovum, it originates from the primordial germ cell. Now what if this primordial germ cell becomes malignant, becomes tumorous? Then the tumor will be dysgerminoma. Now it is homologous to seminoma of the testes. It is homologous to the seminoma of the testes, which you study in this surgery. Now this is the most common malignant germ cell tumor. Okay, so most common benign germ cell tumor or most common germ cell tumor was dermoid cyst or the benign teratoma. But the most common malignant germ cell tumor or most common malignant germ cell tumor in the young ages is dysgerminoma. So this question again they have asked this in the PYQ of FNG, that what is the most common malignant germ cell tumor. Okay, now if a young girl is coming to us with the ovarian mass, then we have 4 tumors in our mind. Number 1 and first and foremost, it is benign teratoma or the dermoid cyst. Number 2 is choriocarcinoma. Number 3 is yolk sac tumor, and number 4 is dysgerminoma, which is the most common malignant germ cell tumor. So this benign dermoid cyst or benign teratoma or the dermoid cyst, we can easily identify this tumor on the ultrasound, because the content of the tumor is hairy structures, maxillary teeth and all this. So we can easily confirm it by its ultrasound characteristic. But for choriocarcinoma, we have to go for the tumor marker, and the tumor marker of choriocarcinoma is HCG. Okay, the tumor marker of the choriocarcinoma is nothing but HCG. Okay, is it clear everybody? And the tumor marker of yolk sac tumor is alpha fetoprotein. You all know that yolk sac serves as a nutrition to the fetus in the early pregnancy. So protein, alpha fetoprotein is the protein which the yolk sac secretes. Okay, and HCG is what the chorionic villi is a hormone which chorionic villi secretes. Okay, now the tumor marker of dysgerminoma is LDH. So if a young girl is coming to us with a ovarian mass and we are not able to on the ultrasound we are not able to see the dermoid cyst, then we will get these three tumor markers done, which are HCG, AFP and LDH, to rule out choriocarcinoma, yolk sac tumor and dysgerminoma, right? And most of students, you answer that we will go for CA125. No, CA125 is a tumor marker of serous cyst adenoma, and serous cyst adenoma is a epithelial cell tumor type, and it is most common in old age. So it has nothing to do with young age. So next time whenever you are answering the question of ovarian tumor masses, you will first see that what is the age. Okay, and if it is old age, you will go for epithelial cell tumor and their types, and if it is young age, you will go for germ cell tumor and their types. Now let us see what is discussing here. 25-year girl is there, and it is a ovarian mass and benign characteristic. So 25-year girl, ovarian mass and benign characteristic. Let's say what the options are there. Serous cyst adenoma. No, serous cyst adenoma is epithelial cell type and it is found in the old age. Okay, right. Brenner tumor is again an epithelial cell type, and here the content are solid. Okay, and it is also found in the old age. Again, we will not go for this since the girl in the question is young girl. Dysgerminoma is, yes, it is a germ cell tumor. It can be found in young age, but it is the most common malignant type germ cell tumor. Since here they have asked us benign tumor, so answer will be the teratoma. So the answer is teratoma. Yes, this is germ cell tumor and it is most common germ cell tumor, and it is the most common benign germ cell tumor. Okay, I hope you like this ovarian tumor classification valuable. Do share, subscribe and like my channel, and give your honest feedback in the comment section. Thank you.